Hello, my name is Charles Mulligan. I'm a member or professor in pathology at St. Jude Children's Research Hospital in Memphis, Tennessee. ALL is acute lymphoblastic leukemia. Acute lymphoblastic leukemia is a tumour or cancer of the blood system. It is a tumour that develops from a type of blood cell called the lymphocyte, a cell that is normally responsible for fighting infection, for example, viral infections. In acute lymphoblastic leukemia, cells that would normally develop into lymphocytes become diseased because they acquire mutations or genetic changes that block their normal growth and development. Because of that, the cells don't mature into normal lymphocytes, they don't have their normal infection fighting effect, and also they proliferate in an uncontrolled way. Eventually, the result of this is that the acute lymphoblastic leukemia cells, often called blasts, fill up the bone marrow and cause symptoms. And these are typically tiredness or lethargy because of a lack of red blood cells, infections because of a lack of normal white blood cells, and bleeding or bruising because of a lack of normal platelets that are normally responsible for blood clotting. Because ALL is a cancer of the bone marrow and blood, it's typically found throughout the body at the time of initial diagnosis. It's in the bone marrow, it's in the bloodstream, and it may also occupy other sites of the body as well. For example, in the central nervous system, in the linings around the brain, and in other sites of the body as well. Because of that, when treatment is eventually begun for ALL, it typically involves a combination of drugs and routes of drug administration to kill cells in all sites of the body. So typically giving drugs intravenously and periodically by lumbar puncture into the central nervous system, at least into the fluid around the CNS. ALL is a relatively uncommon tumour in terms of overall numbers, but it is actually the most common tumour of childhood in the young. It remains a leading cause of cancer-related death in the young as well. And this is despite the overall cure rates being generally favourable. In the developed world, cure rates for ALL in children exceed 80% and in many countries exceed 90%. But again, because it's a relatively common tumour in children, and because some children are not cured with initial treatment, it remains an important cause of cancer-related disease and death. ALL is less common in older individuals, in adults, but historically treatment success rates have not been as high with increasing age. We know many of the reasons for that now, and that relates to the underlying genetic changes that drive ALL that differ often between children and adults. And there are many subtypes of ALL defined by the genetic changes, and some of these are more difficult to treat, and those subtypes are more common with increasing age in adults. Now, that said, both in children and adults, treatment is changing and changing quickly. Historically, treatment has been conventional chemotherapy, even radiotherapy, which is less widely used now. And those treatment approaches have not been tailored to individual types of leukemia or the genetic changes that drive them. However, that is beginning to change, and there are a number of new treatments, both specific drugs that target different genetic missteps in ALL cells, and also newer treatment approaches, particularly immunotherapy and cellular immunotherapy called CAR T-cell therapy, that have made profound changes in the success rates of treatment for ALL.